Well, we told you yesterday about Pizza Hut's weighted blanket. The pizza chain teamed up with Gravity Blanket to offer a weighted blanket that looks just like your favorite kind of pizza. Well, they sold out in hours. The blankets were sold at $150. The original pan pizza blanket was designed to use the power of weight to relax your nervous system. The blanket weighs 15 pounds and measures 72 inches in diameter. Well, with sleep aids like weighted blankets and other ways to fall asleep, we thought it would be best to discuss ways to get the best night's sleep. Dr. Joseph Ojile with the Clayton Sleep Institute joining us now to talk about some ways to get a better night's rest. Good morning to you, Dr. Ojile.
Good morning, Margie. Good to see you.
Good to see you as well.
Happy Thanksgiving.
Same to you. You know, you are usually seeing patients, I'd say in their 50s and 60s, but I understand you kind of have a growing segment of the population that you're treating now.
We are. We're seeing more and more young people, especially folks under the age of 50 coming in, given all the stressors that are going on in the last 6 months, that are having difficulty getting to sleep and staying asleep. So we've really seen a spike in that age population.
Yeah, we were just talking about the weighted blankets. There are all obviously other sleep aids. Can they really help you get a better night's sleep?
Well, the weighted blanket issue is very interesting, and it does appear for some people there is data that indicates that the weighted blankets do help people get to sleep and stay asleep a little bit easier. You're seeing this in different segments. For instance, there's a takeoff on that with the little children. They have these weighted blankets and sleep sacks and things like that. And older folks, the pressure, the weight does appear to, from a sensory perspective, to help people get to sleep. So it is a nice little aid. For folks. May not be the total solution, but it's one a little helpful aid that could be beneficial.
I mean, is it sort of like swaddling a baby with the weighted blanket?
It is that sort of concept, right? That it's the act of the pressure pushing down. It's neurosensory, and it can help in some folks. So it's interesting that it was stumbled into by an inventor, and it's worked rather well for some people. But for most people, we need, especially right now, what we're seeing is there's two big things that are going on, Margie. One is with so many people working from home or working odd shifts, they're losing the structure. And as you well know from our previous conversations, that structure is key. So somehow using the time we have to structure your sleep time, bedtime and wake time, really prioritizing those things and winding down, because the natural, of course, you're not driving home from work, so you're losing some of that wind down in your day. So putting structure not only into when you go to bed, but structure into that hour or two prior to bed to do the wind down, and that we're having to really educate folks and work with them on how to do that. And ways we do that are things like worry journals, where they document and write down things that are on their mind from the day. Meditation, if they're spiritual, prayer, those things will help people wind down. Because as you know, you don't put yourself to sleep, you allow yourself to go to sleep, and that takes some expertise just to allow ourselves to enter sleep naturally.
Yeah, it's part of the problem during the pandemic, Dr. Ojile, is that not only kids at home virtually learning, looking at a computer for so long, many people working from home, that their senses are just worked up from all that?
You are right on it. Yes, the computer, for two things. One, the activity at home is elevating both the stimulation and some emotional elevation, of course, anxiety. And then all the constant screen time does suppress melatonin in many folks, and that causes them to have trouble entering sleep, because you need melatonin to get to sleep. So for quite a few people, we're suggesting that they take low-dose melatonin, which you can buy at the store. Take that about 60 to 90 minutes before your bedtime. And we are seeing some good results with that as far as just general helpfulness in staying asleep during the night.
Some great advice for us this morning. Dr. Joseph Ojile with the Clayton Sleep Institute. Thank you so much for being with us this morning. Good to see you.
Good to see you, Margie, and you have a great week with you and your family next week.
Thank you. Happy Thanksgiving to you. And if you'd like to learn more